Hello, guys, welcome back to All Around Health Talk. It's been a while because work has been really hectic, but we're back making our videos. So, welcome back to today's talk show. And today we want to talk about fibroids. Well, today I will be talking about fibroids. Fibroids is very frequent in the life of women and basically in Nigeria, in Africa, and generally worldwide, women are suffering from fibroids a lot. Fibroids basically are very benign tumors, which means that they are not malignant. But these tumors will form in the muscles, the smooth muscles of the uterus of the woman. So the fibroids can have different sizes. They can grow so big, and sometimes they can be really small. What are the factors that increases our what are the factors that increase our chances of getting fibroids? Basically, number one risk factor is your age. Fibroids are very frequent in women from the ages of 35 and above, and at the age of 50, from 35 to 50, basically that's the window where this medical condition appears because it's related to the secretion of the hormones estrogen and progesterone. And so because before puberty and during menopause, your body reduces the secretion of these hormones or do not even secrete them. They are not fibroids are not frequent in that age, so it's between the ages of 35 and 50. Apart from age, race is another factor that increases our chances of having fibroids. And unfortunately, fibroids are very frequent in black women. Black women have higher chances of suffering from fibroids than any other race of women. Apart from race, apart from age, there is also the menarche. Menarche is the first menstrual cycle that a woman presents in her life. So basically, most women will present their menarche at the ages of 12, 13. Those who present menarche before 12 or 13 years old, those who present early menarche, like at the age of 9, at the age of 10, have higher risk of having fibroids in the future. And also, pregnancy and the number of kids you have can also increase your chances of having fibroids because of the remodeling process that the uterus goes through after every child delivery. Apart from these factors, studies have also shown that increased intake of alcohol and increased intake of caffeine can increase your chances of having fibroids. Now, knowing what fibroids are and knowing what could increase our chances of getting fibroids, how does these tumors present clinically? Basically, the first way they present is by an abnormal bleeding. So you're bleeding, but you don't know why you're bleeding. You're bleeding outside your menstrual cycle. So you've had your menstruation for the month, but then you're bleeding in very large quantity after your menstruation. So that is like one of the first symptoms of fibroids, abnormal bleeding. Apart from that, most women will feel a kind of pressure in the pelvic region. So you feel like there's a kind of weight in your pelvic region. Apart from that, you could also feel like there's a mass, like an increase in the size of your pelvic region. Sometimes people might confuse it for pregnancy, but no, you just have a fibroid growing in your uterus. Apart from these symptoms, it could also affect your urinary tract because as the fibroid grows within the uterus, it can compress your bladder, and so if that happens, you would have painful urination. Some people have painful urination. Others have what we call urinary urgency. It means that you cannot control your urge to urinate. You have the urge to urinate, and before you get to the bathroom, you've urinated on yourself. It's called urinary urgency, and sometimes others could present as urinary retention, where you have the urge to urinate, but for some reason, the urine doesn't come out because it's being retained in your bladder. So, apart from the fact that it could affect the urinary system, it could also present as infertility or miscarriages. So some women, for some reason, are always having a miscarriage, or they've been trying to get pregnant and they can't get pregnant. It could be that you have a fibroid. It's not necessarily your village people that are doing it. It's probably a fibroid. Now, these are the ways fibroids would present in cases where the fibroids are symptomatic. But most times, fibroids are not symptomatic. It means that they do not show symptoms. So again, it's important for us to go for regular checkups, because if they don't show symptoms, then you never know you have a fibroid until it gets really bad. So these are clinical symptoms, what would help us think in the direction of fibroids. How do we diagnose fibroids? Basically, for us to diagnose fibroids, we'll need to do an ultrasound. An ultrasound is very cheap, it's affordable, basically affordable in most parts of the world, and so it's much more advisable than the other option, which is an MRI. But an ultrasound, it's not as efficient as an MRI. So first of all, we can use an ultrasound, which could be an abdominal ultrasound on your abdomen, or it could be a vaginal, transvaginal ultrasound, which means it's the equipment will be introduced through your vagina. Now, the transvaginal ultrasounds are more efficient because they can locate small fibroids. Apart from ultrasounds, MRI is the next step. MRIs are very efficient, very, very efficient, but they are very expensive. So those are the two main methods that we can use to diagnose fibroids. So once we have our diagnosis of fibroids, how do we treat? The ultimate treatment for fibroids would be a surgical intervention. But for some reasons, you do not carry out surgeries. You carry out, or you do non-surgical treatments. We always have to consider the age of this patient. We also have to consider the person's desire to have kids. Okay, if we have a patient who is young, who has plans of having kids in the future, then a non-surgical method would be advisable. In this case, you would have to take contraceptive pills. You might have to take IUD would be placed in your uterine passageway. You could also have to take other hormonal drugs. The treatment with drugs are not for long term, they are short term treatments, and basically you could use them when the fibroids are small, when they do not present symptoms that affect the activities of the patient. But apart from using the non-surgical method, there is also what we call the uterine artery embolization. In this case, it's basically to introduce a substance that is going to reduce the flow of blood to the fibroids. So it's like blood doesn't get to the fibroids, they don't get their food, so they begin to shrink and they die. So it's another method, it's invasive, but it's another method for treating fibroids. And apart from that, the ultimate method for treating fibroids is surgeries. You could do a myomectomy, which is taking out the muscle which is being affected, the muscles of the uterus which is being affected by the fibroid, take it out with the fibroids. Or you could just do a hysterectomy. Now, a hysterectomy is taking out the whole uterus. That is like the ultimate treatment. You take out the uterus and you don't have to think about fibroids, because fibroids will grow in the muscles of the uterus. So if there is no uterus, they can never grow anymore in this patient. So that is the ultimate method for treatment. This is all we have for you on fibroids, but it's important for us to repeat that constant health checkup is very, very important, especially because fibroids can be very asymptomatic, because most of them will not show symptoms. The only way you can find out is if you're going for regular health checkups. And also because among the risk factors of presenting fibroids, Most of them, majority of these factors are not modifiable. You cannot change your sex, you cannot change your age, you cannot change your race. The only factors that we can change will be our intake of alcohol and caffeine. So basically, because we are women and it's so frequent in women that it's been right now there are studies that are beginning to consider fibroids as a normal occurrence in women because of how frequent and how rampant it is in the female. It's important for us as women to be at the top of our game when it comes to our health. Go for regular checkups, see your gynecologist, have yourself checked out. If you have bleeding that you do not understand that is outside your menstrual cycle, please go see a doctor. And please and please and please don't forget to share our video, like our video, leave a comment, ask a question, and let's keep sharing health informations to as many people as possible so we can help ourselves. Thank you for watching. See you in our next video. Bye.